Okay, last little brown part, most of it means a lot of the same thing. If you turn to the 3 R's, the next page, this is mental retardation. Often there is no cause, no known cause. Here's what you write: developmental handicaps, because we don't call it MR anymore. Developmental handicaps, mental retardation. It could be many different things, but the number one thing that causes it is fetal alcohol syndrome. Fetal alcohol syndrome, number one cause. Okay. Now, for this child, it could have also been related to infection like meningitis or maternal exposure to chickenpox or measles or CMV, cytomegalovirus. I want you to put at the very bottom cerebral palsy, because it's very much like this. But cerebral palsy is spastic muscles and nerves that hurt. Muscle spasms that actually hurt with mental retardation. So the child has developmental handicaps with painful muscle spasms. Often they need a baclofen pump. Baclofen pump. The difference between cerebral palsy and mental retardation is the cerebral palsy child had a lack of oxygen to the brain either during pregnancy, during delivery, or the first 30 days of life. And I'm going to say it again, don't worry. The difference is that the cerebral palsy child had a lack of oxygen either during pregnancy, during labor, during delivery, or the first 30 days of life, which means the neonatal period. Remember, the first 30 days is a neonate. If it was during pregnancy, it was probably due to preeclampsia or placenta previa or abruption. Preeclampsia, placenta previa, or abruption. If it was during labor, it was maybe the patient had late decels and the nurse ignored it. Late decelerations. During delivery, prolapsed cord or shoulder dystocia. Neonatal period, write this down. Kernicterus. That is severe jaundice. Okay, that's that. Turn page real quick. Lead poisoning. Okay, lead poisoning and accidental poisonings. Remember, lead poisoning babies are children who are anemic at 3 and older are automatically considered lead poisoning until proven that they're not. So anemia in 3-year-olds and up is considered lead poisoning until proven that it's not. These homes built before 1978 are at risk for high lead levels. It causes irreversible brain damage, and it can cause kidney failure. Prevention includes wet mop or dust frequently because lead is tracked in through dirt. Wet mop or dust frequently, at least once a week. Run the cold water in the pot to cook with, never the hot. Remember, lead is from contaminated pipes. When you run water, hot water through those pipes, you just melted the lead right into whatever you're about to cook. So use cold water. We learned that in cooking class. Use cold water to cook with. Also, boil the baby's water for formula. Iron and vitamin C lead to decreased lead. So a diet rich in iron and vitamin C will lead to decreased lead levels. We screen at 1 year old, 2 years old, and if those are abnormal, 6 years old. The magic number, because there's so many numbers on here, is 10. So just highlight one number. Blood levels greater than 10. You see the 10? Mm-hmm. Yep, that's all you got to know, 10. Magic number. Remember, you can have paint, soil, and water contaminated. Everybody in this room better know Flint, Michigan story. Do you remember that? Yes. They switched the water source to a piece of shit cheaper source, which had a shitload of lead. What you didn't hear and you should have heard, but I followed it, so I did read it, and I do know it, was that it wasn't just lead. It was also what I teach you in toe-to-toe, Legionnaire's disease. They lost 83 people from Legionnaire's disease at the same time. You didn't hear that. But that's exactly what the water source had in it, Legionnaire's disease. And it also had high amounts of lead. So far, so good? Okay. Let's see here, turn the page. Iron poisoning, all I want you to know is acetylcysteine treats acetaminophen overdose. So this is aspirin, which is different, but everything on the page is just what aspirin is. But I also want you to add acetylcysteine is the antidote for Tylenol, because we see more of that than anything. So acetylcysteine, which is mucomist, right? Mm-hmm. Equals antidote for Tylenol overdose. Okay, so that's kind of like a big thing. Aspirin poisoning is going to affect the ears. You already see ring, ring, tinnitus. You should put hearing loss. Add on this sheet, put on the sheet, abstinence withdrawal syndrome. This baby with abstinence withdrawal syndrome will have a runny nose, frequent sneezing, irritability, jittery, high-pitched cry, nausea, vomiting, diarrhea, poor feeding, hypersensitivity, this will happen within 24, 48 hours of birth. The mother was either on heroin, fentanyl, or oxycodone, or some other opiate. Heroin, methadone, oxy, fentanyl, some kind of opiate. For this child, you need to put mittens on their hands or socks on their hands at night. Well, usually during the day too, I must say. So put the mittens or socks on their hands. Lay them on their right side after feeding and try to swaddle them and decrease the stimuli. On the drug abuse page, if you have a drug overdose page, put fetal alcohol syndrome and failure to thrive. Does everybody know what Munchausen by proxy is?
Yes.
Yes.
Good. That's where you take your kid in there and act like they sick. Eminem said his mother did that all the time. So if you didn't know what that is, just know that that's what that is. Okay, you're pretending like they sick because you want to stay in the hospital and get attention. So on this page, you're going to put on this overdose page, you're going to put fetal alcohol syndrome, and then you're going to go ahead and put failure to thrive. Now, number one, these parents with failure to thrive kids, unless there's an organic reason like sickle cell or cystic fibrosis, they are usually on drugs or alcoholics. Failure to thrive parents are usually on drugs or alcoholics. They neglect their children, no affection or attention. They do not sit up by 8 months like other children. They don't walk at 15 months like other children. Failure to thrive, okay? Their weight is 80% lower than other children. They have small head circumference, weight and height, malnourished. Okay, so that's that. Okay, now I told you to put fetal alcohol syndrome on here. Fetal alcohol syndrome, learning disabilities, microcephaly, flat philtrum. Let me write that down. Flat philtrum. Okay. Which is a thin upper lip. And that philtrum is this tiny little spot right here. It's like a crevice above your top lip. It's flat. I have someone in my class that has this, but obviously it's mild. Severe growth deficiency. The middle of their face is flat, so all in here is just flat.